Complementary and alternative medicines, so-called CAM therapies, have been used by adults to treat their children with cold and cold-like illnesses for a long time. There is a move now to use some of these CAM therapies, of which there are some research and scientific data to support their use, along with more conventional therapies. This is what we call integrative medicine. There was a recent study showing that actually sleep, this was in adults, actually had a decreased amount of cold and cold-like illnesses if more than 8 hours of sleep was given a night. I think that's also true for children. So things like sleep and good nutrition, fruits and vegetables, are often more important than trying to give a different type of medication or dietary supplement. However, in the past there have been some dietary supplements that tend to be immune stimulators, such as echinacea and astragalus, that has been shown in some children to actually improve or shorten the duration of cold and cold-like illnesses. My advice to parents who are looking for non-traditional or non-conventional therapies to cold and cold-like illnesses, especially young children, is to be very careful, especially when they look at the internet. There are many traditional remedies, such as herbal remedies, such as ginger and ginseng and other types of things that have been used for hundreds of years. However, they also may have their significant side effects, just like we're finding in some of the over-the-counter products that have now been recommended not to be used in children under 4 to 6 years of age. So I recommend that they discuss any type of therapies, whether it be dietary supplement or different types of remedies that you may even inhale, be discussed with their healthcare practitioner, especially their pediatrician or family practice physician. I believe one of the more important things to advise parents when dealing with children with cold and cold-like illnesses, especially young children, is to pay attention to some more of the comfort cares, such as sleep, adequate nutrition, fruits and vegetables, and hydration. The relationship between cold and cold-like illnesses and the use of vitamin C has been discussed and used for many years. Vitamin C at one point was thought actually to help prevent colds, but it has actually been found in studies of both children and adults to possibly decrease the severity and duration of a cold, but not necessarily prevent the cold from occurring. Children with asthma present a special problem where they develop cold and cold-like illnesses, since colds can often be a trigger that can make asthma much worse. And so if a child does develop a cold or cold-like illness and the asthma symptoms such as cough, difficulty sleeping at night, or difficulty breathing tend to increase and medications commonly used for their asthma are not helping, then that would be a time that they should contact their physician.